Hey guys, it's Dave. Today we're going to talk about xerostomia, otherwise known as dry mouth. It happens to almost everyone. It can be caused from nerves, anxiety, dehydration, nasal congestion, but did you also know it can be caused from aging, just getting older, nerve damage, radiotherapy, if you're going through cancer treatment, that is a side effect of most of them. Diabetics have issues with dry mouth a lot. A lot of medications can cause dry mouth. Blood pressure medications, diuretics or water pills, anxiety medications, antidepressants, antihistamines, so the diphenhydramine, the loratadine, the Claritin, those kind of drugs can cause dry mouth. Parkinson's drugs, bladder drugs, and some chemotherapy drugs can cause dry mouth, just to name a few. There are many others, but those are the main ones. You can also get dry mouth from having damage done due to things like HIV, AIDS, stroke. Alzheimer's patients have difficulty with it because they're not eating, drinking the same as they once were. If you drink a lot of alcohol, or if you're a smoker, both cigarettes, marijuana, anything else, you will tend to have dry mouth. If you're going through menopause, you can also have dry mouth. And some of the drugs that are used to treat menopause can also cause problems with dry mouth. And then Sjogren's syndrome, which is where the immune system actually attacks the salivary glands, can cause dry mouth. It's not very common, but it does happen. So why do we want to take care of this? Well, when you get dry mouth, it can cause, of course, dry lips, soreness in the mouth, bad breath, but it can also alter your taste, so you're not tasting the way you once were. It also alters your biome within the mouth, so that can affect you as far as being able to fight off infections and things like that. It makes you prone to getting infections in the mouth like thrush. It also makes you more prone to getting cavities. And with those cavities, you can get infected teeth as well. It also can cause problems in swallowing, so you may lose weight, not for the good reasons, as well as being able to speak clearly. Dry mouth can cause problems with that as well. So that's really why we want to try and take care of this problem. Now, there's not a whole lot of treatments out there. If you have Sjogren's syndrome, pilocarpine, which is an oral tablet, can be used, and it helps to increase the saliva production. However, it will decrease your blood pressure, so you want to be aware of that. Cevimeline is another drug out there that can help with dry mouth. But there are a lot of basic, simple tips you can do at home to try and help yourself out. Number one, drink a lot of water. If you notice I said earlier, alcohol can cause problems. Water is water. Pop doesn't help you at all. Water is what you need. Tea, coffee can cause dehydration and dry you out. Stick with water. Propel, if you don't like just drinking straight water, Propel is fine. You can add some flavorings to it. You can try BioLite, which is a hydration drink you can do. You can also try Liquid IV. That's a great product that will give you a little flavor in there. I also like Hint. The other thing you can do, especially in the heat, is suck on ice. It will keep your mouth moist longer than just taking a drink, but it will help you with both hydration and keeping your mouth moist. Chew sugar-free gum or sugar-free lozenges. I like, when I have somebody that's put on a drug that is having trouble with dry mouth, it's hard to find, but I like lemon drops because it will really get those saliva glands going with the pucker that you have to do in sucking on them. So that's some ideas you can do. The other thing you want to do is you want to brush your teeth often, not only because you have a higher potential of having dental disease, but you're adding moisture to your teeth and to your gums and to your tongue every time you brush your teeth. And do brush your tongue. Then the things that you may want to talk to your doctor about is talk to them maybe about lowering the dose of some of the offending medications. See if that would help out, or possibly you might be able to discontinue the med altogether and maybe switch to another one. The other thing, if possible, that you can do is switch from taking them at bedtime to moving them up earlier in the day. You definitely want to talk to your pharmacist or doctor about that before you do it. But that can help because when you're going to bed, you're laying awake at night and your mouth is open. It dries out the mouth naturally. Well, if you take it in the morning, you're not falling asleep. Your mouth is probably not going to be as open as it is when you're sleeping. So that's something you want to check with your provider on that. The other thing that can cause problems is if you're congested. If you have nasal congestion, that can lead to dry mouth. So you can look at some over-the-counter options for decongestions. Sudafed is one, but there's also Afrin nasal spray. Afrin should only be used for 3 to 4 days because you'll get a rebound congestion. If you're using Sudafed, you want to talk to your pharmacist or doctor about that because it can elevate your blood pressure. But there are some things that can help out, as well as Breathe Right strips. That will help open things up so you won't be as congested, so it won't have as much problems with dry mouth. The other things that you can do as far as tips and tricks, decrease your alcohol consumption, cut back on smoking or quit altogether. Avoid sugary foods and drinks like pop. Again, that can be dehydrating. Sweet tea can be dehydrating. Avoid spicy foods. They tend to act on the salivary glands to make them so they don't work as well. So you want to stay away from those as much as possible. Avoid alcohol-containing mouthwashes. You want to look at the label on that. They do make them without alcohol, but that will dry out your mouth as well. If you wear dentures, take them out at night. It's very important to give your mouth a break, and it will dry your mouth out more if you leave them in at night. Avoid high salt foods. I'm a lover of sunflower seeds. However, they are one of the worst culprits as far as drying your mouth out. So be aware of that. There are some saliva substitutes you can buy over the counter. TheraBreath, Biotine, and Act make some really good products that taste pretty good too. And there are some gums that will help out along those same lines to help at least take the edge off. But the main thing again, drink a lot of water.